We cannot solve this problem using decades-old solutions.
Exactly.
We have to be able to be innovative, we have to be creative, we have to be willing to reach our growing edge and actually move to a place where we are thinking about, these 21st century issues and trying to come up with 21st century solutions.
Right. And you can't be scared, just be brave about it. What's the worst thing that can happen? People just gonna be healthier.
Project PrIDE is a 3-year demonstration project funded by CDC. It stands for Prep Implementation, Data to Care, and Evaluation to identify how we can increase PrEP uptake among men who have sex with men and transgender women, focusing mostly on African American and Latino populations. Health departments were not funded to implement or address health equity or social determinants of health. Our health departments really said, this is what we need to do. We've got to address this.
They said, yes, this is an HIV project, but if we don't deal with some of these health equity issues, if we don't deal with this mistrust that has been there for years, then it's not going to work.
A lot of times you hear the terminology, hard to reach populations, and that's not always the case. It's just having the right people at the table who can actually go out, connect with the communities, and provide them with the services that they need.
The navigation programs need to be the right navigation program. The individuals involved in providing those services need to be people who are trusted by the populations they're providing the services to and be able to show an emotional investment in that work. And that it's not as simple as a lot of people thought it might have been when we first started. Like, here's a bunch of money, do some PrEP implementation, do some data to care implementation. And folks have really learned the struggles of providing those services to populations that don't trust us.
We have to be willing to have very honest and frank conversations that these systems, these racist systems, these homophobic, transphobic, heterosexist systems are what is perpetuating burdens of disease in very specific communities, in communities of color, in our LGBT community. And when we start to take stock that we are part of that system, it can be somewhat disheartening to think that you're contributing to this struggle. But at the same time, I think that once you're willing to be honest and that we all can have a common language and have a common context, I think it then helps to transform the way in which we approach this work.
At our very, very first grantee meeting, I recall just looking around the room and seeing all of the brilliant minds and saying, man, if we're all embarking on new activities, I wonder if there's a way that we could stay connected. And the Learning Collaborative has been just that for us, a place where we can lean on our colleagues, our experts, to help us figure things out.
We were able to just interact with one another via the portal in a way that was really true and really lovely. There's several people within the health department as well as our delegate agencies that are all contributing to this magnificent savings account of ideas and innovation and inspiration that we can all draw from.
What sometimes happens with these very short-term grants is that folks spend a lot of time developing something and we often don't hear about it until it's a presentation at a conference or a paper that's being published years later. This was an opportunity for folks to see things in real time.
The collaborative has been great because it helped to reinforce that we are in this work together, knowing that when we bring our work in alignment, that we can really transform what this epidemic looks like across the country.
There was so much love in the Learning Collaborative. It just felt like a powerhouse of people all working to achieve the same goal.
One of the major goals of Project PrIDE is to expand awareness about PrEP, that PrEP exists, and so all of the sites focused on some type of social marketing campaign. And there's been amazing examples of really innovative work.
Instituto Federal de la Raza won one of the Positive Force Awards for Best Ad Campaign, and we were able to help fund them and work with them to get that campaign rolling. It's called the Viva PrEP campaign. Awesome campaign, really tailored towards Latino values and traditions.
One of the things that I think is really great about the work that we're doing in Louisiana is that we're building awareness around PrEP in the general community and not making it as if PrEP is only geared toward one particular group. Because when we continue to focus on that particular group, it suggests that there's something inherently wrong with them, and it places a level of judgment on folks that we're trying to remove.
We are shifting the way we operate to better meet the needs of everyone else involved. And that's not the way it used to be. It used to be we needed, as the CBOs, needed to adjust our programming in order to meet some of the needs of our funders. And it's really refreshing and a beautiful feeling to do it the opposite direction.
We put into our RFP that you had to be geographically located within the area that you're going to serve, because you can't assume that you're going to be able to duplicate anything from one side of town to the other. You have to go with the culture of the community.
Coming from the State Health Department, I am simply a guest in the community that I hope to serve. So I need to go to the community to make sure that they guide the work that we're doing. It would be unfair and a disservice for anyone to look at the most recent research about what's going into the community unless we actually engage the community to let us know what's the truth behind these numbers, what's the truth behind this report.
Our state planning groups all have task force that are MSM driven, and this year we moved into having trans-Pacific task force. And so because they were our priority population groups, it was amazing to be able to have their voices at the table, not the voices of people who were representing them, but their voices at the table.
When we were in the process of rebranding, some participants felt that could have been potentially stigmatizing going into a place called an STD clinic. And that was kind of how we went into the process of changing our name to a sexual health clinic, which is a little bit more affirming and more sex positive.
We've been consistent in building a relationship. We've put out different products. We did a photo voice project that I have no problem in saying, I believe it was amazing. Tell us what's going on when you engage medical services. What are some of the challenges of being a Detroiter, being a young MSM, or being a young trans woman?
We were able to conduct 2 digital storytelling sessions, one with MSM of color and one with transgender persons. We left the digital storytelling to an umbrella term of sexual health. And there were a few people on my team that weren't as comfortable with that because it's very exploratory and we may not get anything about PrEP. And I said, that's just as important, and we need to know what they're talking about because those are their priorities, and we have to work to understand and to address these other priorities before we can start facilitating PrEP.
We still have a lot of challenges in trying to encourage clinical providers to provide PrEP. There are a lot of biases that we have to face. So a number of the sites have focused on academic detailing or working with clinical providers to be able to encourage them to consider PrEP and prescribe it for people who may benefit.
We launched the pharmacy-based PrEP program. You went in, you wanted PrEP, at the pharmacy, we'd make it happen.
People can go in there for PrEP, but they could be going in for blood pressure medicine, they could be going on for anything. And it really improves access and reduces stigma. At City Clinic, which is our municipal STD clinic, one of the really great things that we're able to do as a result of PrIDE is to bring in really novel testing technology that let us do STD testing, gonorrhea and chlamydia in people who were there for getting HIV pre-exposure prophylaxis or PrEP, and to be able to give them a result in 90 minutes before they even left the clinic in some instances and get treated if they needed to. It was really very patient-centered, and it was a new way of doing things.
We developed what we call a PrEP triage card. So every patient that walks into the door of the sexual health clinic completes this card, which has 8 questions on it about PrEP or about behaviors that you engage in. And then if a person is simply just interested in PrEP, they can receive PrEP navigation services. Every month we receive reports of how many patients we've provided navigation services to, and it's only been growing at a really high rate.
We have linkage to care coordinators who are basically the backbone of the project. They bring the humanity to the data to care. So they're the ones making sure that they get to their appointments, accompanying them to their appointments, making sure they understand their lab reports, just helping them to understand their overall health.
The perseverance of our navigators cannot be underestimated. It's a lot of work, and to train that workforce and to prevent burnout in that workforce is something I think we really have to focus on so that we can make sure that we have people who are of diverse backgrounds who can really develop true relationships.
PrIDE has catapulted us forward, and even as the project is ending, we have to keep that focus on the disparities work. We have to take the lessons we learned about collaboration and engaging community and thinking differently and continue to incorporate that and weave that into the fabric of our work.
For the longest time, we know that people of color have experienced tremendous disparities when it comes to health outcomes, but to really see that when we're willing to really challenge ourselves, we can really move the needle and make progress when it comes to ending this epidemic.
We have to have the wherewithal. My wherewithal piece is about folks having the heart for it, not just having a job for it, but having the heart for it, because what comes from the heart reaches the heart, and that's what's going to really make a change and a difference in the communities.